Let's just jump right in. Today, we're exploring spleen anatomy and function. It's this incredibly fascinating, spongy, and densely vascular organ sitting right inside your abdomen. We're going to break it all down, transforming what can honestly feel like a pretty complex medical topic into a really simple, easy-to-grasp explainer. So we'll map out exactly where the spleen is, what it looks like, and why it actually matters.
But before we look at exactly where it sits, I've got a quick question for you. Can you actually live without your largest lymphatic organ? We always hear about people rupturing their spleens in action movies, right? But what does this reddish-purple fist-sized organ actually do? Is it literally essential for your day-to-day survival? Well, the surprising answer is yes. A person can live an everyday life without a spleen. Absolutely. Even though it's the largest organ in your lymphatic system, it's technically not vital. If it has to be removed, other organs, like your liver, step up. They adapt and compensate for its absence. But hey, just because you can survive without it doesn't mean it isn't doing some absolutely massive heavy lifting in your body right now.
So, let's talk about its lifeline functions. Think of the spleen as your body's ultimate, spongy blood filter. It plays a huge role in immune surveillance, meaning it's actively filtering out foreign bodies, viruses, bacteria, and even fungi. On top of that, it acts as this incredible cellular quality control center, constantly monitoring and clearing out senescent, old or damaged red blood cells from your circulation. To see exactly how it pulls this off, we've got to look inside. The spleen is basically made up of two distinct types of tissue. On the left here, we've got the white pulp. You can think of this as your internal antibody factory. It makes up the central portion of the spleen, and it's packed with lymphatic tissue where white blood cells, specifically B and T lymphocytes, mature, multiply, and pump out antibodies to fight off infections. Then, on the right, we have the red pulp, which makes up the vast majority of the organ. This is your heavy-duty blood filter and reservoir. It's full of sinusoids and connective tissue cords called the cords of Billroth. It's basically loaded with macrophages that just eat up those old red blood cells. Plus, it acts like a massive storage unit, holding a reserve pump of platelets and up to 30% of your red blood cells, just ready to be deployed if you ever start bleeding heavily.
Okay, now trying to memorize the exact size and location of the spleen can feel a bit overwhelming. But there's this brilliant little mnemonic in the medical world, the 1 by 3 by 5 by 7 by 11 rule. Let's break those numbers down. The spleen is typically 1 inch thick, 3 inches wide, and 5 inches long. That number 7, that's its average weight, roughly 7 ounces. And the 9 by 11 tells you exactly where it is, nestled safely right between ribs 9 through 11. It's just an incredibly handy trick for remembering its dimensions.
Visually, as you can see, the spleen is tucked safely away in the left upper quadrant of the abdomen, which is also known as the left hypochondriac region. It sits perfectly between the fundus of the stomach and the dome of the left hemidiaphragm. And because it's tucked so deeply behind the rib cage, it normally doesn't extend beyond the left costal arch. Practically speaking, that means a doctor normally can't feel it during a routine physical exam. If they can feel it, it usually means the organ is enlarged, which is a clinical condition we call splenomegaly.
Now here's where it gets interesting. There is a completely bizarre and kind of fun anatomical quirk about the spleen's location and structure that most people have absolutely no idea about. Let's take a look. Believe it or not, 10 to 30% of the population has an accessory spleen. No way, right? Up to a third of us are walking around with a tiny, extra bonus spleen. These are small, totally benign nodules of splenic tissue that sit completely outside of the main organ. They're usually super small, under a centimeter, and they love to hide right near the splenic hilum or near the tail of the pancreas. Sometimes they even end up way down in the pelvis. Moving on to the actual physical architecture of the organ itself. The spleen has two main surfaces. The outside surface facing the ribs is smooth and convex. That's the diaphragmatic surface. But here we're zoomed in on the visceral surface. This side faces medially, pointing inward towards your other abdominal organs, and you'll notice how irregular and concave it is. Right in the center, you can see the hilum of the spleen. That little indented area is basically the primary gateway where all the nerves, blood vessels, and lymphatic vessels enter and exit the organ. Because this visceral surface is pressed so tightly against all its neighbors, those organs actually leave physical indentations on the spleen. We call these impressions. Just look at the distinct colored areas highlighted here. That large yellow area up top, that's the gastric impression, right where the spleen hugs the stomach. The green area is the renal impression, where it rests against your left kidney. That little blue patch right in the middle is the pancreatic compression, exactly where the tail of the pancreas touches it. And finally, the purple area down at the bottom is the colon compression, where it meets the large intestine.
It is a very crowded neighborhood in there.
Separating all these different indented areas are the spleen's borders. Notice that top edge highlighted here? That is the superior border. It's the shortest border, and it often features one or two distinct little notches near the front. Then, running right down the middle of the visceral surface, splitting the stomach's impression from the kidney's impression, is the intermediate border. It's generally a bit thicker and sometimes incomplete. There's also a rounder inferior border right down to the bottom edge that separates the kidney impression from the outer diaphragmatic surface.
The spleen also features two poles, which anatomists refer to as extremities. Looking at the highlighted areas, the lower blue section is the anterior extremity, or the lower pole. See how it's broader, a bit more expanded, and faces downward and forward? Now contrast that with the top purple section on your screen, the posterior extremity. This upper pole is much more pointed and points upward, backward, and medially.
Okay, this next part is often misunderstood. When you look at isolated 3D models or textbook diagrams, the spleen kind of looks like it's just free-floating in the abdominal cavity, right? Just waiting to bounce around. But in reality, it's securely tethered in place. Let's see exactly how. So the spleen is anchored by a really complex network of ligaments, which are actually all components of the greater omentum. These act like essential tethering lines. For example, you can see the gastrosplenic ligament highlighted here, which connects the spleen right to the greater curvature of the stomach. There's also the splenorenal ligament attaching it to the left kidney, and the splenocolic ligament anchoring that broad anterior extremity to the colon. There's even a ligament called the phrenicocholic ligament, sometimes known as Hensing's ligament, which doesn't directly touch the spleen, but it acts like a little shelf to support it from beneath.
Now let's look at the absolute lifeline powering this organ, its massive blood supply. This side-by-side perfectly shows the flow. On the left, we've got the arterial blood coming in. This comes from the splenic artery, a major branch of the celiac trunk. Notice how incredibly tortuous and twisty that red artery is as it runs right along the top of the pancreas? Then, on the right, we have the venous drainage. The splenic vein carries all that filtered, deoxygenated blood away. It runs a much straighter course right behind the artery, eventually merging with the superior mesenteric vein to form the hepatic portal vein.
Running right alongside those blood vessels is the spleen's complex wiring, its nerve supply. The spleen is innervated by the autonomic nervous system through a network called the splenic plexus. The sympathetic fibers, which actually tell the spleen's capsule to contract and squeeze stored blood into your system if you're ever hemorrhaging, originate from the celiac ganglion. Meanwhile, the parasympathetic control, which handles all the normal resting functions, arrives via the vagus nerve. All right, let's bring all of this together with some core takeaways for you to remember. The spleen is your body's highly vascularized, spongy blood filter and reservoir. It manages absolutely crucial immune surveillance and recycles your old red blood cells using its white and red pulp. It is safely tucked away in the left upper quadrant of your abdomen, powered heavily by the twisty splenic artery. And hey, if you ever need to remember its size and placement for a test, or honestly just for trivia night, just recall the simple 1 by 3 by 5 by 7 by 9 by 11 rule. Which leaves me with a final provocative question for you today. Have you ever had your spleen checked for a bonus accessory spleen? Knowing that up to 30% of us are walking around with extra splenic tissue, it's definitely something fascinating to think about the next time you see an abdominal scan. Let me know in the comments if you or anyone you know has ever discovered one of these hidden anatomical bonuses. I really hope this explainer made the complex anatomy and function of the spleen clear, structured, and easy for you to grasp. If you found this visual breakdown helpful and you enjoy learning efficiently, make sure to hit that subscribe button for more simple medical explanations. We absolutely love breaking down complex topics into clear, easy-to-digest concepts just like this. Keep learning, stay curious, and I will see you in the next explainer.